And now medicine could be next. Stuart Leiths has been to Cambridge, where researchers are hoping to use AI in the fight against cancer.
Liz Chipchase from Cambridge is now cancer-free. She was fortunate to be part of a clinical trial for this cytosponge, developed by scientists at the University of Cambridge. The pill on a string is swallowed, dissolves in a patient's stomach and expands into a sponge, which, when extracted, scrapes cells from inside the esophagus, the tube connecting your mouth and stomach. The samples are analysed for a condition called Barrett's esophagus, which can increase the risk of someone developing cancer. In Liz's case, it led to an early cancer diagnosis and successful treatment.
What they discovered, yes, was very much a shock. I was positive for Barrett's esophagus, which didn't really worry me because it's not a terribly dangerous condition. But subsequent studies showed that I actually had cancer of the esophagus, but it had been caught at a very early stage because of the cytosponge trial.
The cytosponge method is quicker and less invasive than an endoscopy, where a camera on a tube is inserted into a patient's throat. The cytosponge has been tested in GP surgeries in East Anglia, but the simplicity of the process means it can generate many more results for doctors to analyse.
What you see on the left screen is the output of an AI that guides the pathologist's eye to particular regions in the image.
That's why a team here at the Cancer Research UK Cambridge Institute has developed an artificial intelligence computer system to help. It looks at cell scans to prioritise them for a pathologist to review, giving them time to focus on the cases that are more challenging to diagnose.
They have to look at these many cells in large images and find cells which somehow look suspicious. They don't look like the normal cells you would expect in the stomach and the esophagus. And what our AI system is very good at is finding small numbers of suspicious cells and highlighting to the pathologist where they should look.
Research is also being carried out here into how AI could be used to assist in giving a prognosis for a patient with ovarian cancer and deciding what the best treatment could be.
I think AI will bring two crucial developments, improvements. One is automating the more routine things that are done in the clinic, and two is improving prognosis through these methods that allow us to make predictions about patients and how they're going to respond. So it's a twofold improvement, really.
And it's not just AI they're using here. A team at the CR UK Cambridge Institute is also developing this virtual reality system, which creates an immersive 3D image of a cancer tumour.
What we can do in the VR is visualize this and interact with it in a way that's much more effective than if you do it just on a flat computer screen. I mean, first of all, the VR is completely immersive, so you can literally walk inside the tumour.
Using AI and VR, researchers are aiming to ensure more cancer patients get faster, effective treatment and a positive outcome from their diagnosis. Stuart Leiths, ITV News, Cambridge.